Dr. Charlie Johnson, physical therapist. I wanted to give shoot a quick video for everyone who's out there, been stretching, trying to treat a specific problem, especially just on the painful side, and is frustrated because they got butt pain, hip pain, they've been told they have Piriformis syndrome, sciatica, a glute tear problem, whatever it is, somewhere in this area, right, and it hurts. And they've been doing what everybody's been telling them, which is generally stretch, sit on a tennis ball, foam roll, do some type of nerve stretches or glides, whatever, and they're not getting the relief, right? So they're doing what the experts are telling them to do, but sleeping might still be, leave them tossing and turning. Sitting, let alone the thought of sitting on a hard chair, right? So it's like, do you walk into a room and look for the softest chair in the room? Are you afraid to go out maybe with your girlfriends? And not this can't impact men, but oftentimes it's middle-aged, younger to middle-aged females. Not sure why. There's some thought about that. And maybe I'll create another video. I'm on a roll here. But yeah, do you prevent yourself from going out because you're like worried that you're gonna have to sit somewhere you're not going to be comfortable, and that's just maybe straight up embarrassing, right? So the point is that realize that everything you've been told to do is really the same thing. So maybe you've tried chiropractic. Maybe you've tried, if you've got this problem, PT. And what did the PT tell you to do? Well, okay, I'll get to that. You've tried chiro, you've tried PT, you've tried massage therapy, deep tissue, right? You've tried yoga. You've tried, I don't know, myofascial. I mean, we could just keep going. You've tried your own YouTube stuff. You've tried a tennis ball. You've tried a foam roller. I don't know. I'm sure there's other things that people have tried, all right? You've tried to release your hip. You've tried hip openers, right? So the point is, if you go to chiro, generally they're going to say, hey, you're out of alignment, and what do you need? You need some type of, something put it back in alignment, so you need adjustments or manipulations or hands-on techniques to get you moving better, to get you more motion. That's key. I'll talk about that in a minute. PT, you've done piriformis stretches. You've done hamstring stretches, right, and so on and so forth. You've done back stretches. Massage, they really, you said really dig in there, right? Get your elbow in there, lean into my buttock, my hip, or whatever. Oh, that hurts so good, but it goes back to the way it felt within 24 hours, or maybe even quicker than that. So deep tissue. You try yoga, and when you went there, it's like, hey, you're just tight, and by the way, everybody says to do yoga, it's good for you, so let's do that, and I'm going to do some hip openers, I'm going to do pigeon pose, I'm going to do whatever, all right? Myofascial release. You've got fascial problems, and therefore we need to lengthen the fascia and release the fascia, right? So that was some type of probably like stretching or massage type of maneuver, right? You go to YouTube and they lay out the 5 best stretches for you to do. You try the tennis ball, and that's just more basically deep tissue, just yourself. Foam roller, same thing, more deep tissue. So there's a reason that all of these things are on one side of the board. You think that they're all different things, right? You think that this is chocolate, and this is vanilla, and this is strawberry, and this is cookies and cream, and I'm like really craving the ice cream during this quarantine thing. So, and I haven't had any. You think this is cookies and cream. Maybe I said that, I really like cookies and cream. You think that the tennis ball is moose tracks, and I don't know, this is coconut something. Right, so you think that they're all different shapes, they're all different flavors, they're all different things because you went to someone else who has a different designation. Right, and what's interesting is they'll call them all different things. These people actually believe that they're all doing different things. And they're not. Most of them are not. All right? So let me explain. Everyone you go to see is wearing their own goggles. They see things in a certain way. So depending on who you go to see will determine what you're told is wrong with you. And it will also determine the treatment that you therefore get, right? If you go to a pizza shop, like you're going to expect that they give you pizza. You don't walk into there expecting anything different. I'm amazed at how many people walk into a surgeon's office and are frustrated to find the surgeon wants to take another image, give him another pill, give him a shot, or give him surgery. And beforehand, I ask them, do you want any of those things? And they say no, and they still walk into that pizza joint. They still walk in to see the surgeon, expecting something different. So anyway, they're all wearing their own goggles, and that will determine what they do to you, right, in the treatment that you get. And by the way, at the end of this, you just walk out there, you just walk out super confused because now you're told you have 20 different things wrong with you. They're all doing the same thing. So let me explain. So it's on this side of the board for a reason. So you can learn a lot in life by living on the extremes. So let me explain. Extremes. So this is, on one side of the curve, lengthening, or another way to say it in your terms would be stretching. This is a continuous sort of line or spectrum here. And everything you've done, you don't have to believe me, but just consider, I'm stepping on some trash here. Everything that you can, or consider that everything you've done is on the stretchy, lengthened side of the equation. Pull point A further from point B. So if we define stretching as taking 2 points, A and B, and pulling them further apart, then that is what we'll call lengthening or stretching. Hopefully you agree with that. If not, I can't help you. Anyway, the point is that chiropractic, they move joints to get you more motion, to lengthen something. Yes, you could argue they're shortening something maybe on the other side, that when you do a stretch here, that you're lengthening this side and maybe shortening that side. But the point is that with regards to the painful area, they're almost always trying to improve motion or lengthen that area. So, lengthen. PT. If you have a butt pain, a nerve pain, or whatever, a PT is generally going to say, hey, here's your butt muscle, point A, point B, and just stretch that out. Here's your nerve, pull on it a little bit more. So they're lengthening, all right? Deep tissue massage. A little hard for me to do here, but imagine there was something here that pushed this down, right? That could do that. And basically, massage is this. You have point A and point B at rest. Massage is just doing this. Point A here. Point B, and here's an elbow. So they're lengthening. Hopefully you would agree that that's further, the shortest distance between one point and then the other. Point A and point B is a straight line. They're taking that and they're making you go around a little circle. All right? So they're lengthening. And then you go and you think that you're doing something different by sitting on a tennis ball, because you've tried that and that didn't work. But really, instead of being your butt in the air and you're laying on your belly and they're digging in your elbow, now you're just sitting on it. So now what you're doing is you're doing this. Point A, point B. And here's a tennis ball pushing in your bottom or your hip or whatever. Or you can replace that with foam roll. Okay, so foam roll is the same thing as a tennis ball, which is the same thing as deep tissue. What else? Okay, so now, those are like the external kind of things, right, that we could use. Chiropractic is lengthening or stretching quickly something. PT is trying to do this. When you go and you do yoga, they're doing hip openers, pigeon pose, piriformis stretch, hamstring stretches on your back. They're trying to take point A and point B on the painful side and pull them further apart. They're trying to lengthen them. Myofascial release. Let's try to lengthen something. So we did that. YouTube, do the 5 top stretches. Lengthen, 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 lengthen. And not just lengthen, even more microscopic than that. Lengthen on the side that hurts. So, what's the opposite of lengthen? What's the opposite of stretching? Shortening. Taking point A and point B and bringing them closer together. So what have you done, either in the painful area or outside of the painful area, to try to shorten your problem? Probably nothing. And if you have, and if you've done something to try to shorten it, then you've probably done it in combination with these other things. So you're saying, I did this exercise, I did this bridge, I did this movement, right? And it was shortening, Charlie. It was bringing 2 points closer together. It was contracting rather than expanding or lengthening something. But The PT gave me this whole sheet of exercises, and the chiropractor manipulated these 10 things, and the massage therapist, they worked on my neck and my leg and my whatever, and I did those things too. You don't actually know. Just like the massage therapist, the chiropractor, the PT, the myofascial, the yoga, they don't know either. What's happening and why you're not getting better, why you're staying the same, why you're getting worse in the majority of cases. Because if you're doing too many things at once, if you're doing 10 different things at once, then you don't actually know what's working. Now, that being said, you can't mix these. You have to live on the extremes. You don't know what dark is without light. Therefore, you don't know what shortening will do if you mix the two. Hopefully that makes sense. All right, so the opposite of this is to shorten. So one simple way to move from lengthening to shortening is to simply get rid of everything that's lengthening. So you can heal by subtraction. Everyone thinks you have to do more. What if you could just take away that which is potentially aggravating you? That's super smart. Bloop, gone. Bloop, gone. Bloop, 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 bloop. Now, you move from here to here. You're neutral. You're neither shortening or lengthening because you're not doing anything. Cool. So you're moving that way. And then you're just going to ask yourself, same, better, or worse. Do I really need those things, or is that just what everybody told me to do? Start to question things, people. Cool. All right, so we got that. Yeah, cool. And then, like I said, everybody is also treating only the painful side. So a common misconception is like it hurts here, therefore everything's got to be done here. So think about it. So here you are. Bad drawing, but there's your back. Right here's your hips. There's your feet. All right. So you're looking from the back to the front. Here are your cheeks, basically. If you're watching this video and you're finding it useful, you might notice that you've got some type of pain on one side, maybe both sides, but usually one side, and it's kind of like deep in the cheek. Maybe a little bit drawing down here, maybe you got some pins and needles, maybe you get a little bit wrapping around to the side of the front, but it's pretty much square in the butt cheek. That's the most common place that people feel these problems, or like in the hip area. Now, notice that when they took the x-ray, when they took the MRI, where did they go? Right here. Like a magnet. They just sucked right to that. Alright? So the surgeons are looking here. Generally, the chiropractor will look here. The PT will look here. The massage therapist, oh, dig right there. Dig right there. What if they treated your neck and it actually helped get rid of your butt pain? Is that possible? Of course it is. Because the whole body's connected. You don't just make that up and hope that helps. You actually test it. So rather than going to a massage therapist for 60 minutes and having them dig into your rear end and causing you pain, right? They don't just dig into your rear end. You might tell them to focus there, but they might go elsewhere. They might say, work on my shoulders a little bit. But what they can do is they can say, okay, find one or two motions that are painful. This pigeon position hurts, and when I bend down or pick something up, that's when it hurts in my butt. Okay, cool. So you've got pigeon and you've got bend down. The two things. Boom, boom. We're going to go back and test those things. And before we get started, I'm a massage therapist working with you. Go ahead and rate those things. On a 0 to 10 scale, since you know that, and you're watching this probably, 10 is the worst ever, 0 is nothing. How bad is it to do pigeon? Oh, it's a 6. It's pretty bad. All right, bending down, oh my gosh, it's a 9. I can't even do it. I have to bend my knee and it's tight and my butt hurts and whatever. Okay, cool. So now what we're going to do is we're going to work on your neck. And every time we work on something, we're going to go back and check to see if it changes that. Does that work for you? Cool. So now what we're going to do is we're going to treat the neck. Because we know that everything here hasn't worked, or it's temporary relief. Oh, by the way, on that side of the spectrum, those massage guns. Holy smoke. Right on the painful area. That's just, I don't know, try it, test it out. Probably not intelligent. The same thing. Instead of doing it, curve with like the tennis ball or the elbow. You're just going rapidly now. So you're not doing anything different. You're just tweaked it. You're just going faster now. It's like you could just have somebody like pulse you on your tennis ball. Like get somebody over top you and have them push you quickly. Same freaking thing. $250, $500 later. Anyway, point is, so right, you can test these things, and then go out here, treat the neck, have the massage therapist work that shoulder, work that neck, and then go ahead, stand back up and do the forward fold. If you feel 50% better with both of these, maybe this goes, the pigeon goes to a 3 and this goes to a 4, then just stop the session right there. You don't need the other treatment. So the 10 things, the 10 areas that they were working on, if you actually go test, retest, you find that the shoulder, working on my shoulder actually relieves my butt pain the most. And if you don't believe me, have them go and just say, hey, I want to run an experiment. I saw this video from this crazy guy named Dr. Charlie. He's a PT in PA somewhere. And, you know, we've been really working on this area. It's not really getting me where we want to go. Can you work somewhere else? Maybe the opposite side, maybe the neck, maybe the shoulder. Who really cares? Maybe the calf. And can you tell me, well, and then after we do that one thing, I just want to stand up and check to see if, you know, the things that were bothering me were any better. And what you'll find most of the time is that 1 or 2 of those 10 areas that they would usually work are actually what were helpful. So then you can just ask for your money back and say, hey, you know, we're just going to do 15-minute sessions now. So the point is that the 80-20 rule, probably 20% of what that massage therapist, so the PT, the chiropractor, whoever is doing, or you're doing, is giving you the results. 80% of the results. Instead, if we do all this stuff and we don't actually go back and check, then we don't know. All right, so the point is everybody's going here, but it's possible that if you use a smart, logical system, this is a system, a formula for relief, that you can go back and you can follow basic logic and rules to say, is the same, better, or worse? How do I know? And if it's better in the moment, then if I replicate that over and over again, it's probably going to continue to get better. If it's worse right in the moment, or it makes no change, then it's probably not going to get better. It's probably going to get worse, or continue whatever trend it was on. So, looking at this painful area is like, it's like this. If you have a pizza, that's 8 pieces, right? If you go to a local pizza shop, you get a pizza. This is like this. So let's just say that this right butt cheek is down here. Only treating that area is like everybody running and trying to just like grab that one piece of pizza. And when that piece of pizza, they're just smashing this pizza. Like just picture, you're like running, you're getting this pizza, you're like elbowing like granny as you're going there. You know, you bite off a piece of the crust, and then your neighbor's like, I want the tip, boom, they're biting that, and then you just like, this pizza is just mashed up. That's the same thing you're doing here. I know it's like exaggerated, but the point is everybody is looking here. And then I come along and I say, okay, well, y'all can fight over that, but I'm just going to walk over to this side of the table and grab this piece of pizza. Thank you. Y'all can keep fighting there. I'm going to do something completely different. So by treating the one side of the area and stretching only that painful area, by working only in the area that hurts and stretching it, you think you've tried everything, because everybody else has called it different. But you've really just taken one piece of pizza, and I'm here to tell you there's 7 other pieces left. What if you worked the other leg? What if you worked the trunk? What if you worked the arm? What if you worked the neck? What if you worked the same-sided arm? What if you worked the same-sided, I don't know, hip? What if you stretch that buttock? Well, you've already done that. And all that this tells me, all that those failed treatments tell me, is that all you've done is you tried to go after this one piece of pizza. There's hope. There's way more hope, actually, than you think. So, the idea of this is that, number one, everything you've been doing is lived on that shortened, in the area of pain type of sort of theory, approach. And again, if you've watched this long, then you probably are somebody who, number one, needs to hear this and hasn't responded well to those things. So just realize that you can treat outside of the area. And there's a system, a test, retest, a formula for actually getting relief with these problems. Instead of living on the extreme, hopefully you can see you've lived there, mash it, stretch it, lengthen it, pull point A further from point B, what happens if you actually try to shorten it? So the first step is eliminate all those things. Boom, what do I got? No stretching, no mashing, no lengthening, no whatever, anything on that painful side. Nothing. And just right there, you'll start to learn something. You'll move the needle towards shortening or towards less angry. And then we can start to test one thing, not a whole sheet of things, not 20 different areas of getting massage and feeling good for 10 minutes, not cracking 20 different joints and hoping that miraculously you get better over the course of 2 months, 3 months, 4 months, 6 months, whatever it is, however long people watching this video have been dealing with this problem. Okay? That's it. That's all I got. I'm done. If anybody has any questions, comment below. Appreciate everybody watching. 484-552-3767. If you need help working through and finding a specific, systematic, formulaic, a method, a process that someone can teach you such that you can solve your own pain problems. Hope this is helpful, everyone. Stay well. Thanks.